We have a lot of headlines to get to, but patiently waiting through that entire description of what the heck this crazy broadcast is none other than the mayor of Pontiac. We saw her yesterday in the press conference in Oakland County with Dave Coulter, and now she joins us here live on the MegaCast as I hit just another button or two. Mayor, you have to forgive me. There you go. We see you now. To keep our social distancing here, I'm the only one in the studio right now, so I'm running a TV and a radio show here at the same time with my fingers and trying to talk to you. So thank you for being understanding. Good morning. Welcome to the MegaCast.
Good morning, and it's great to be with you, David, and to talk to my friends and neighbors all across Oakland County. And I understand you're wearing many hats here. I understand that as we're all working remotely, as I am running a city. With the same kind of challenges that you have working remotely.
My challenges are absolutely nothing. It is an absolute pleasure to be here every day and do what we can to help out. And but you have your hands full in Pontiac. We, in Oakland County, clearly have a very high number of coronavirus cases. We've had, unfortunately, way too many deaths. And you got your hands full. But today, a bright sign that we're moving in the right direction. We are beginning testing in Oakland County and in Pontiac. Why don't we start off today, Mayor Waterman, by telling us all about that?
That was an announcement that was made yesterday. I was happy to stand there, or virtually stand there, through the broadcast with the Oakland County Executive David Coulter, as he and his executive team announced the partnership with Honor Health to bring in the first testing site in Pontiac. This is one of the drive-through mobile testing sites. This adds to and, of course, augments all the testing that's being done at the local hospitals, and our first responders are doing a magnificent job. They have been working so hard to save lives and to treat people who have been taken down with this serious disease. But this will be the first mobile site, and it is right here in Pontiac. We are the county seat as well, and this is going to be at the Circuit Court Complex at 1200 North Telegraph. We want people to know this is here and available. It's been long awaited, and testing is so important because we're realizing that the one of the guideposts of how we're controlling the spread of the disease and how we can continue to ameliorate this disease in the community is through looking at the data and tracking the records and the demographics of the people who are affected by this or the contagiousness of it.
Well, well said, Mayor, and it is so important. It's so critical, and we have a lot of people focused on the next step right now, and everyone agrees that we cannot get to the next step without testing. Plus we'd also like to know where we're at right now. So it's essential. It's an essential part of our going forward plan, and it's a big part of making sure that people we know who's healthy, we know who needs a helping hand right now.
Exactly. And that's what we want to do. We're remembering all those who are suffering with this disease, and nobody in Pontiac doesn't know someone who has either been affected by it or quarantined by it, or there's now 17 deaths of Pontiac residents. So this is a number which is affecting all of us. And the reality of the situation, I think, is there. What we can do as a community is to pull together in spirit and realize if we all cooperate and doing the precautions that have been advised to us by our healthcare professionals and both by the orders from our governor now, who is struggling mightily to control this curve in Pontiac and the neighboring communities. So we're happy for the municipal help that we're getting and that we're all united in this effort to slow the spread of this disease.
Everyone's doing a really great job, Mayor. First of all, I really appreciate you taking time. I know how busy you are. Thank you for taking time to talk to us. You look great on Zoom. We got all that working. It's amazing, all this technology that we have. So thank you very much for joining us so we can see you and hear you today. She is the mayor of Pontiac, Mayor Deirdre Waterman. And Mayor Waterman, we need to know. We need to know who's sick. And people need to know that they can go get a test. So up to now, most of us have understood that the only way we can get a test is to call our physician or call the county health department. We need to be sick before they want to test us because we only have limited testing. How's it going to work at 1200 Telegraph at the county courthouse when people want to go get a test? How's that going to work?
Well, this testing is for people who are symptomatic. So you have to have one of the symptoms that has been identified and people know what those are. fever, non-productive cough, um, um, trouble breathing, diarrhea even. So these are the things that if you have symptomatic and you can't tell, whether it's COVID or not, and you need testing, then you call the number. May I give that number now? It's 1-800-848-5533. That's going to start tomorrow, and it's going to go from 9 a.m. to 5 p.m. So that's available now. We also have a hotline number in the city of Pontiac that's available to Pontiac residents, and that is 248-758-3300. And people can call with all kinds of questions or resources. And that's how we've gotten the information out to our community, as well as through all the PSAs and the website information that we're getting out. Just giving people all the information. I think that's one of the things that's cut down some of the anxiety, is people know that there are resources for food distribution. We're now up to 9,000 some meals to our senior centers to help our seniors and our disabled and homebound who we can deliver them to. So just a lot of people have stepped up to do that, which supports the wraparound, as well as now bringing in the testing is going to be just another step forward in terms of curbing this intrusion of the disease in our community.
So many different aspects of this entire thing: getting people fed, making sure their health is taken care of, just being there for people when they have a question, and so the anxiety level isn't so high. And then our first responders, we've been talking to first responders around Oakland County, curious how things are going in Pontiac. Fire departments and EMS units around the county have been telling us that they're able to make the calls. They're able to keep up with 911, and the hospitals, at least as of right now, and they consistently have said that we've had the beds. Is that the case in Pontiac as well?
Yes, they are stretched. I'm thinking about the hospitals now. We do talk with them, and I've done a couple PSAs with the hospital directors of the outpatient center and the emergency room, and they are not overwhelmed like some communities. They do have capacity, but they are stretching their limits. They're using creative and innovative ways to be able to make sure they can service all the population who needs them right now. But it means a lot of people are putting in a lot of hours, working long shifts, and we wanted to celebrate them. I wanted to reach out and say to them, we thank you so much in this community. And it brings to forth that they're making sure that access to healthcare is not limited, as people are losing their jobs, and their healthcare is being challenged right now in terms of how they obtain that. So that's one of the things we're looking to, and making sure that it's accessible to everybody who needs it, because for one person to be treated also protects the rest of us. So we're all bound together in this. It's all tied together in a chain of interrelations. And so that's why it's important for our hospitals and our healthcare agencies to be able not only to give the right advice, but to make sure that they are controlling the symptoms and letting people know how they should behave given the symptoms they may have.
Mayor Deirdre Waterman joining us from Pontiac today via Zoom on the MegaCast. How about EMS? How's that going? EMS, fire calls, police calls. You've been able to keep up?
They're doing amazing jobs. They're able to keep up, yes, and we want to help them too, because some of our first responders now have begun to test positive. So that has decimated some of the forces a little bit, but the others have just filled in the patches to keep up going, have to keep going, and to service. So they are challenged, but they're able to meet the challenges, and it's just a voice of gratitude from this community for all that they're doing. And one of the ways we're supporting them is we started a program just last week, in which we're matching some of the restaurants now who have limited patronage because of the shutdown order, and are looking for ways that they can help the situation with our first responder, matching them with donors who are willing to provide meals to our first responders. So I'm just happy for the number of people who've stepped up to be donors for that, and support our restaurants or our small businesses in town as they're floundering during the shutdown, as well as pay homage and help our first responders who are working long shifts and late hours. So we've had a number of groups who've stepped up to provide the funding to do that, and I thank them. And I think that's just the way that we're supporting all the work that our first responders are doing to keep us healthy, and to help treat those who are the ones who are taken down of
Mayor
this disease.
Waterman, that's one of those win-wins that we're seeing so much of right now. People coming together in our community, supporting the people that are making the greatest effort, the biggest sacrifices. The media reports out today are indicating that the first responders, but more prominently, the nurses are testing positive in bigger numbers than anybody. So we see that, and it's affecting a lot of nurses. And the biggest demographic there is women who are between 25 and 54 years old, and it makes sense. I mean, that is not an exclusive demographic for nurses, but it is a prominent demographic for nurses. And we're seeing media reports today that their percentage of contracting the coronavirus is higher, and it only makes sense. They're right in the front line. These medical workers are literally risking their lives every day when they go to work.
Yeah. And I don't know if you realize it, but my background before I was the mayor, I practiced as an ophthalmologist. So I still have a lot of colleagues in the medical field, and I talk to them almost daily to find out what their challenges are, to know how much they are at risk, with all the protective gear and everything that they're doing. There's still a paucity of getting that. And so the hospitals are working to get enough supplies to protect our healthcare responders. But even with all that, they are, a lot of them have been infected. And so it's really a very, very contagious and mysterious virus that we're dealing with. And they're learning something about it every day. In terms of watching the demographics and how it spreads and how it affects people.
Well, and certainly one of the things we have unfortunately learned, and it's been reported in the national media, the local media, we've talked about it a little bit here on our program, is the fact that this nasty, deadly virus is having a greater impact on the African American community than any other community. It's a community that many say is medically already at a higher risk, and this is making things even more difficult. Do you have any thoughts on that, and any mediation or anything that you're hearing that might be able to help that situation, or just your thoughts in general on it?
Yes, and that is the data that has been kind of astounding as we've looked to see how the depth of it and the disproportionate way in which African Americans, particularly, are suffering from complications of the disease is also a reflection of many factors, I think. And as people are assessing that, we're realizing it's not only health, access to health, and the fact that it's a lot of the African Americans who are often in these essential jobs where they're still working, where the rest of us are safer by working remotely. It's the fact that some of these people are in industries that are affected by the shutdown, and so they've lost their jobs now. We can see by the number of people who file for unemployment because they are laid off due to the coronavirus. So there's a lot of socioeconomic mitigating factors, but we wouldn't have known this had not the data that was collected began to reflect these factors. And that's why it's extremely important. And that's why this testing is even more sequential for the outcomes for communities of color. Pontiac is 51% African American, and so that is extremely more important for us because that affects the outcomes and that affects how this disease affects this community. And as we know, Southeast Michigan is known as one of the hotspots across the country. So the data, and that's one of the things I'm going to be talking to the local health department, Oakland County Health Department later today, is we need to make sure that we're really graphing this and getting that data collection in a way that will be indicative and informative, that will help us not only understand the prevalence of this in certain populations, but also how we're controlling it and how that can affect treatment and how it can affect outcomes, because it efficiently save lives.
Well, we are seeing news accounts today. Maybe you could talk to this, and I know we're running out of time, but there are news accounts today here in Metro Detroit that says that folks are calling for adding this data that you refer to, data on race and the impact the coronavirus is having on certain segments of the population, adding that data to the data that we're collecting. Do you think that's a good idea?
Well, yes, it's an extremely good advice. It's important. It's essential to do that. And we've done it for every other disease, every other crisis. that's a normal part of health information gathering. As the healthcare practitioner, every form we filled out recorded those essential kind of demographics because we know that that can help to guide outcomes and treatment. Uh, the African Americans Association that I'm also a member of did send a appeal to both the director of the CDC, Dr. Redfield, as well as the Surgeon General of the CDC. We want the CDC to begin to do this tracking and collection of the data and recording it because it's so important, as we've seen. If we had known about this, how this particular demographic was being affected through data analysis some time ago, that might have very well demonstrated how healthcare practitioners could affect that kind of treatment with that in mind. So this is life-saving information, and it's done for every other kind of disease collection, and we should do it as well for this.
Do you think, Mayor, that in addition to tracking the information, it might be helpful to test certain communities more aggressively? I know we only have so much testing capacity right now, and all we're doing is testing folks that are symptomatic, but maybe it wouldn't be a bad idea to start doing some more widespread testing in the African American community to try to prevent some of these deaths that have been happening. Your thoughts?
That's what we need to have more capacity to do. And I think this first mobile test site is a good step in that direction, but this is something that we're kind of behind on right now, and we're playing catch up. So everything you said is true, and the more testing we can get, the more we can be in control of our destiny.
All right. Well, the telephone number to call is let me see if I got these right, and we'll put them on our website, 800-848-5533, 800-848-5533. That's the number you call if you're in Oakland County and you'd like to go to the new testing center. You said it starts tomorrow. Is that correct?
That's correct.
Okay. So you call that number and you'll talk to somebody and they'll get you scheduled. You can't just drive over to the Oakland County campus. You need to call before you go, correct, Mayor?
That's correct. Please buy plane.
Okay, so 800-848-5533, the number for the city of Pontiac, the helpline 248-758-3300. Mayor Waterman, thank you so much for being with us today. Very helpful information. Anything you'd like to share with our viewers and listeners before we say so long?
Well, thank you for having me. Thank you for helping to spread this information. I think we control our destiny a little bit, and we help to be of service by giving these resources and that information to the public. I think we all got to get through this together, and let's see the light at the end of the tunnel so we can get back to whatever that near normal is going to be. And I'm just happy to be of service to the community.
Well, thank you, Mayor Waterman. Sounds like you're doing a great job. Thank you for joining us, and we look forward to chatting with you again right here on the MegaCast.